Well, it's Doctor of Mind. This is another of my series on drugs of abuse. So I understand you're doing cocaine. I'm a psychiatrist. My name is Doctor of Mind. I'm going to explain why it's not a good idea and you got to stop it as soon as possible. Cocaine, as you know, is a stimulant, but it's extremely potent. There's less potent stimulants. It initially causes euphoria by depleting dopamine quickly in the brain, but as a result, you can then crash into depression later on. The reason it's involved in psychiatry is you'll often see it abused, either patients intoxicated or with mental illness doing it, say a manic patient going on a cocaine binge. Unfortunately, you can take it in a variety of ways. Remember, it was in Coca-Cola. Okay, fine. Then you have the IV, smoke, snort, with all of the associated medical complications of the route of administration. See, if you do cocaine, forget the cocaine. The IV will give you what? Hepatitis, cellulitis, HIV, endocarditis. If you snort it and smoke it, you'll get bronchitis, cardiovascular disease, respiratory infections. And so even the route of administration causes the other general medical conditions. I guess the most important part I worry about is not so much the psychiatric, the paranoia, anxiety, everything, insomnia, euphoria, depression, depending on which state you're in, but the physical side effects. This is what'll really kill you. Cardiovascular episodes, chest pain, irregular heartbeats, arrhythmias, heart attacks, strokes, seizures. The cocaine is extremely dangerous in the cardiovascular system. Now imagine if you're on pros, say Wellbutrin and cocaine and testosterone and coffee. You got to take into account the additive effect of all the stimulants. Basically, after you reach 50, it's going to be hard for your body physically to even deal with the medical complications. What I recommend is get treatment. There's acute treatment. There's a vaccine to inactivate cocaine. It's an antibody. It attaches to the cocaine molecule and inactivates it for acute intoxication. But then I would recommend seeing a psychiatrist and getting assessed for underlying depression. What happens with the stimulant abuse like cocaine is you damage the depression circuit in the brain. And oftentimes say, I will need to prescribe maybe a low-dose tricyclic like Doxepin for such a patient. That's interesting, isn't it? You wouldn't think of that. The atypical antipsychotics are safer than the typicals, as shown under the microscope with neurotoxicity. So, if you go paranoid, psychotic, and break out of restraints, you can get that treated. The other problem with cocaine is the violent nature of suicide. Remember my suicide videos, the top 20 methods that I got criticized for? Well, if you got to know the most common methods, and then when you overlap cocaine intoxication, you'll see the violent, less common ones become the most common. For example, my work with the methamphetamine, stabbing, murder, suicide, and firearms become very popular, whereas they're less popular in the general population. So the cocaine can make the suicide much more violent. Now, I recommend getting assessed. And what about bupropion? Is that similar to a stimulating type of drug of abuse? Well, at UCLA they're using Wellbutrin or bupropion for meth patients. So, there's some good promising work upcoming to show there's going to be treatment to help you, say medical treatment to help you get off of this. You really need to get off of it. It's a dead-end path. What about the psychosocial aspects, the legal trouble, the criminal behavior, the destruction of the family and work and all that? And also your genetic factors you have to take into account. Your vulnerability towards addiction, suicide, mental illness. Please stop it. There's withdrawals, but it's not going to kill you. Alcohol and benzo withdrawals will kill you. Cocaine withdrawals will not kill you. But you probably will need some psychiatric medication, and it's a lot milder than perhaps what you're doing. If you're self-medicating, get treatment. Usually I published an article that about 80% of cocaine addicts either have a medical or psychiatric reason they're doing that, which is treatable. So please go get help.